Welcome everyone to our first webinar of 2022 that is part of the Synergy Auxilium Social Protection webinar series. My name is Tim Lann, a Social Protection Program Manager here at Synergy International Systems, and I'm very excited to be hosting and moderating our panel of incredible experts. For those of you who don't know, Synergy is an international development technology and consulting firm working globally on projects with USAID, the World Bank, UNDP, and many other development organizations and partner government ministries. One of our technical areas of focus is social protection, and we've started this webinar series with the goal of sharing our knowledge with the global community of social protection practitioners, researchers, and project implementers. So welcome all of you to our first webinar of 2022. We're so happy that you could join us. Once again, if I could please ask that everyone remains on mute and keeps their camera off. In the Google form that you filled out to register for this webinar, there was a section where you could submit questions. I've already selected some that you have already submitted to me, and I will ask those to our panelists near the end of the webinar. If you have any additional questions or questions come up as we get going here, please send them to me directly or to Synergy International Systems in the chat box, and I'll do my best to get through as many as I can before our hour time is up. So the theme of today's webinar is unifying social protection efforts in the Caribbean, lessons learned from Bahamas and Barbados. Synergy is currently working on projects with both the Ministry of Social Services and Urban Development in the Bahamas and the Ministry of People Empowerment and Elder Affairs in Barbados. I'm joined today by an absolutely incredible roster of social protection experts. First up, we have Jaimie Humes, who is the Social Protection System Administrator with the ministry in the Bahamas. She is a social protection expert with over 18 years of experience in the field of social services, and she has helped lead the design and development of the management information system for the ministry. So Jaimie, welcome.
Thank you so much, Tim. It's a pleasure to be here to join in this experience.
We're so happy to have you. Next up, we have Lilit Gasparyan, who is Synergy's Social Protection Program Director. She has over 15 years of experience managing social protection projects globally, and she currently helps lead projects in Nigeria, Trinidad and Tobago, and Bahamas and Barbados. So Lilit, welcome.
Thank you, Tim. Welcome. And I also want to welcome our global audience and welcome you, Jaimie, as well. So looking forward for an exciting webinar.
Yes, we all are. And finally, we have Harutyunyan, who is a project manager focused on social protection at Synergy. She is a social protection MIS expert with over 10 years of experience working on Synergy projects globally, and she is currently working on social protection projects in Bahamas, Barbados, and Trinidad and Tobago. So Leah, welcome.
Thank you, Tim. Hello, everyone. I'm very happy and excited to be part of this interesting discussion.
Thank you so much, Leah. And just a production note here. Unfortunately, Dorian Best could not join us today due to some extenuating circumstances. So Leah, who is a Synergy team member, is filling in to talk about the Barbados project. So just wanted to give that update. So now I'm going to go ahead and turn it over to Jaimie to introduce the Bahamas story.
Thank you so much, Tim. 10 years ago, the Ministry of Social Services and Urban Development would never have dreamed that we would be sitting in such a forum as this to discuss the advancements of social protection within the Bahamas and our story of getting to promise. Our story began in 2004, where the Bahamas established a social protection task force to look at all of the ills within the Bahamas, but more so, how can we unify, put into legislation, and more so to assist in unifying all of our programs within the Department of Social Services. That task force, with the assistance of Dr. Blank, did a study. And the study that we found had to establish what was the level of poverty within the Bahamas. From there, after establishing that, we went on to decide that we needed to look at our legislation to ensure that there was a framework in place to provide for us to move forward. After which, we began looking at the Department of Social Services assistance programs in conjunction with our partners from the National Insurance Board, where we looked at what was the non-contributory old age pension. The Department of Social Services provides continual assistance to many persons within our country, but we wanted to ensure that we were reaching our poorest of the poorest, as we say, or those persons who require the assistance of the social protection. From there, in 2014, we began to compile our social safety net unit. That social safety net unit worked along with IDB to develop, evaluate, and to establish our management information system. That management information system was being used to take our paper-based process into a digital area. As a result of that, it took many meetings for us to analyze, many discussions, many exercises within our communities to ensure that we captured the information from our clients to assess and determine that we were providing for them a means of assistance through the Department of Social Services. I am happy to say that we are now with Promise, and our Promise is our social protection management information system. In 2020, with Dorian, which was Hurricane Dorian, as well as the pandemic, we realized that we had to modify what was in place. We had to enhance and develop a new module. And so with the advancement of technology and the support of Synergy, we were able to reach out to our clients from a digital aspect and expand to some of our portals and online services. Thank you, Tim.
Thank you so much for that introduction, Jaimie. Now I'd like to hand it over to Leah to introduce the context of the Barbados Project.
Thank you, Tim. So in Barbados Pulse MIS system, we are on the design phase of the project and have a lasting plans with the Ministry of People Empowerment and Elder Affairs. MI system itself, I will be sharing my screen. MI system itself will help to deal with daily operations within the ministry. Beyond the single platform, different departments within the MPA will be operating with cash transfer and other social programs. With Pulse MI system, we have developed a centralized database of households and personal profile. With validations applied on the households, we ensure data accuracy and we ensure that there are no any duplications in the system. It means when dealing with the household records, we ensure that several layers of validations are applied and there are no duplicated data in our Pulse MIS system. For example, if one person is enrolled in a household, the system will ensure that the same person will not be enrolled in another household, which will be, of course, a duplicated data. In this example I provided, the validation is done based on the national registration number. So in Pulse MIS, the national registration number should be unique. Another layer of validation is the integration with Electoral and Boundaries Commission of Barbados, which will ensure that the registered beneficiaries and the household members, the records are found in the Electoral Commission, so that if the record is not found, the person is not found there, the system will require to obtain the national registration number. If it is found, it will be considered as validated. So the key objective of Pulse MIS is the automation of welfare services and other departments within the Ministry of People Empowerment and Elder Affairs. Using the Pulse MIS system, welfare department will be providing food, educational, rental, financial, burial, and other assistances. With a National Assistance Board, the National Assistance Board is targeting and registering the vulnerable senior citizens. Like if there is an event of disaster and there is a need of that kind of assistance, National Assistance Board will be providing that assistance. Also, National Assistance Board is providing home care assistance, which will be also covered in the scope of the Pulse MIS system. With National Disability Unit Service will facilitate and provide empowerment of persons with disabilities to ensure equal opportunities for participants in all aspects of community living. Child Care Board is responsible for the care for all the children under age of 18 years. Child Care Board is providing foster, adoption, and residential assistance, and not only. Of course, again, using our Pulse MIS system. And the interesting fact is that the Child Care Board has its own system currently running, but after launching our Pulse MIS system, the Child Care Board will be shifting to this unified platform for their daily operations. The next will be the HIV and AIDS unit. This department is responsible for spreading the public information through news and media. Using our Pulse MIS system, this unit will be conducting different kind of dynamically adjustable surveys with their tablets, and of course they will have opportunity to get some reports from the system which will be related to the HIV and AIDS unit. Next goes the BEX services, which will be this service will be assisting the unemployed citizens for finding jobs, either local or overseas. So the basic goal of this unit will be connecting the employer with the employees. Bureau of Gender is to ensure the gender equality in all national development plans and policies. And also this unit prepares and provides human rights reports. Next, it goes Strengthening Human and Social Development Project, SHSD shortly, which contributes to the reduction of extreme poverty and unemployment in Barbados. This project provides assistance to 250 households in a period of 4 years. The program focuses on the following pillars, which is the personal identification pillar, education and human resource development, family dynamics, and health promotion. And the last but not least, it goes poverty alleviation and reduction program. And the main goal of this program to identify economic and humanitarian set of measures to ensure the reduction for poverty reduction and to permanently lift the beneficiaries out of the poverty. And of course, at top, it goes our public portal in the scope of our Pulse MIS system, which will provide opportunity for the beneficiaries to have a contactless submission of the applications without the necessity to go to the center locations for submitting their applications. So this was the main scope of our Pulse MIS system developing for the country of the Barbados.
Okay, great. Thank you so much, both Jaimie and Leah, for that wonderful introduction. So the Bahamas started this process of unification before Barbados did. Bahamas started this back in the mid 2010s. So I want to focus, Jaimie, on some questions for you first. So my first follow-up question is, how do you define effective unified social protection? And how did the ministry approach this question? And how have you been implementing this unification strategy?
Thank you, Tim. So for social protection, unified social protection, we understand that it takes a collaboration of our various government agencies. The Ministry of Social Services and Development, when we began our task force, sought to partner with the National Insurance Board, the Ministry of Education, of course, our Ministry of Health was also involved as well as our judicial system. And by partnering them, we ensured that we looked at the whole family. We needed to ensure that children were being taken care of, that their health needs were being met, that immunizations were being done. We also found that we wanted to ensure that children were attending school regularly, participating in schools, and being able to meet the requirements from the Ministry of Education and not be left behind. We also would have sat down with the National Insurance Board. Additionally, we partnered with statistics because for the key part of it is we needed to ensure that we had the basis of information before we moved on. We needed to know in our country, the Bahamas is an archipelagic country. And what that means is we have so many islands. And what we discovered is the level of poverty amongst those islands differed. And so we needed to establish for every island or area, how can we define those persons that needed our assistance? Additionally, we would have gone through, met with our partners and discussed some things. How do we provide gender equality and protection? How do we look at that and assess that? We would also determine what are the help needs that we continue to need within it. We would have sat down and then came our Department of Social Services. Within the Department of Social Services, we have various divisions that are also attached to those partners. They speak to them, they liaise with them. And so the relationship developed where we were playing integral roles within the department. What did we learn? Well, how do we approach this? By putting together a social protection unit, we found that we had to first gather our information, look at our business process. What were we doing? What did we need to change? How can we simplify it? And how can we capture the necessary data from the communities to ensure that the programs were valuable to our clients? What else did we do? We began to look at what was our means of paying persons. How can we provide that assistance? And so much not paying, but providing a benefit to those persons. It was a means of empowerment. We saw the need to empower our clients. Thank you.
Thanks so much, Jaimie. Could I actually ask just a follow-up on something that you said in there that I think our audience may find really interesting? So you mentioned the different islands, and each island has different people at different levels of poverty. Could you talk a little bit more about how you went through that process of identifying the metrics, proxy mean test, whatever it may be, to create that framework for each island?
So the first thing we did was we did a national poverty survey. And so teams went out into those islands. They would have asked the various questions about health, about how persons were living. And then we partnered and did the household survey. And that determined for us what was the average household surviving off, what they were living off. And so by developing that, we used those questions to develop our proxy means test, along with the consultants, which we found was unique because in New Providence, which is the main island in the Bahamas, the level of poverty differed from one of our southern islands. And in those southern islands, we had to look at the demographics of how persons were living, what were their household structures. Additionally, we had to, what was their source of employment and how big of the family structure it was. And so we identified those issues, those went into our factors, and to ensure that, did they have the basic needs? Did they have food, running water? How did they have their household structures and the basic needs required? And so using that, we worked with our consultants and they developed a proxy means test. And within that proxy means test, it had to vary according to the sections of the Bahamas. So we would have grouped them according to our Southern Bahamas, our Central, and our Northern Bahamas.
Okay, excellent. Thank you for that. Thank you for that. Jaimie, my next question for you is, what were the key challenges that you faced associated with coordination and harmonization among all of these different programs?
I smile, Tim, because the first thing is buy-in.
Yes.
You are presenting a new way. You are presenting a new product, and in presenting that new product, everyone needs to buy in. And one of the challenges is when we begin to tell our story, so many times we are used to what was or the way that we would have done things, but we now needed to encourage everybody to buy in, but not encourage them, but educate them on why was it so necessary for us to ensure that we were reaching the right set of persons, that as social protection, we saw inclusion of everyone. And how did we assess those persons and develop a system in which we could gather all of that information? If you think that we have been doing paper-based processes for a long time, and you're now telling persons we're moving into a digital era. And if you think when we first started, the introduction of the digital era, computers, MIS, and database were new. We've now moved on where we have webinars. And so persons are now familiar and comfortable, and such that we have moved on where we now have a web-based portal where persons can sit in their homes and apply for the assistance that they may require. So our first challenge was buy-in. The other thing, because of the islands, we found it was difficult sometimes to assess and get the necessary tools and the manpower. So in anything, there's the use of resources. There's also our needs of obtaining the correct information. And so helping persons to understand that we were able to speak in a unified language, but be able to reach everyone.
Okay, that's great. Thanks, Jaimie. I mean, we have several people in the audience right now who are actively involved in social protection programs. So they may be facing a similar challenge with buy-in. What advice would you have to them specifically on these education efforts that you were talking about? What would you want to share that they may find helpful?
Everyone loves a good story. And one of the things we must look at is where were you before? How did you first start out? What are your goals? What do you need to establish? What does your country, organization, or company want to do? How do you intend to get there? So you must look at it and say, this is my goal, but you have to create a story of those key goals and utilize the resources available. And when I say utilize the resources, get the individuals involved, go into the communities, see what may be happening in each community, assess for them how their lives need to be changed. And so they also have to buy in as clients. They will have to buy in. Are they willing to participate in this? This is going to be something new. Get them excited about wanting to try something new, but more so make sure that your team continues to present one message, one consistent message of what those goals are.
That's a great point about one consistent message. Thank you so much for all of that wisdom that you just shared with us, Jaimie. Lilit, I want to move over to you and ask a question about what are the ongoing efforts that we, Synergy, are working on together with the ministry in the Bahamas, and what capabilities does Synergy Auxilium, that platform, provide? And how are we looking to design a social protection information system to ensure that beneficiary targeting and assistance is done effectively?
Thank you, Tim. Thank you for that question. So we are working with the Bahamas starting since 2015, I guess. So it has been a long journey. And the current status of the project is that, like JB explained, it's launched. So it's being used by the programs in different islands. And the current status is that the project is under the maintenance and support phase, where Synergy continues to support the project so that the ministry can sustain it. The platform that lies within the solution, actually both for the Bahamas and the Barbados, is the Synergy Auxilium. So I'm going to share some slides to give more information about it. Just a second. Okay. So the platform, Synergy Auxilium, it mainly has two components. One of the components is having a unified social registry, which is practically a database of beneficiaries. And data is collected on a household level, on a member level, and the data that is collected, it is being fed into the indicators that represent the targeting criteria. So basically, this unified social registry feeds the process of selection, targeting, and enrollment. So here we can see like more details what kind of data is collected. So data related to the income, to education, to disability. So every single data that is going to determine the eligibility. And in a way of having all the indicators and the calculations, we would automate the proximing testing so that the system can advise on which beneficiaries would benefit most from the assistance. So that it can advise whether they meet the eligibility criteria or no. And having a unified social registry to be used across different programs that the solution supports benefits to have one single platform for all kinds of different programs. The other component is the integrated beneficiary management. So it starts with the enrollment into the programs or with all the eligibility decisions. And let me add on this that due to the capabilities of the platform, two types of targeting or enrollment can happen. First one is that either by a self-targeting or by targeting from the program directors of a specific target audience, the system would determine whether they correspond to the eligibility criteria. And then since business process automation tools and management tools are in place, so in the process of different approvals of relevant stakeholders, the application to the program can be approved and the person would start receiving benefits. The other way is since the system, it has all the data for different programs, including their targeting criteria. And also we have the data on the beneficiary side, like the database that would determine their poverty level on different scales. So the system can suggest what are the programs and what is the assistance that the benefits that the beneficiaries would benefit most. So basically it can even estimate, okay, what would be the number of beneficiaries to be enrolled in the next payment cycle. So this data-driven decisions would help with the allocation of funds or other things. So this is about the enrollment. So then the actual provision of the assistance, whether monetary or non-monetary. In case of cash transfers, so Auxilium has the capabilities to be integrated with different payment service providers so that people don't have to walk a certain distance to collect actually the benefits, and they will just receive the cash on their mobile account or with any other means of integration. For cases where this is not possible, whether because this is an in-kind transfer, so like assistance distribution points would be defined, whether it is food or clothes. And again, it is preferable that the distance is calculated so that it is a reasonable amount for the person to walk to collect the benefits. And then they would actually collect them. Within the same process, the reconciliation happens. So having feedback and having reports whether how many beneficiaries actually received the benefits, because distributing is one thing, but having proof of receipt or proof of payment is a different thing. Again, for payments, this can be done automatically, and for in-kind transfers, like manually, people would select if the payment was paid or not paid. For me personally, the cherry on the top is the integrated monitoring and evaluation system. Because this would help the program directors or policymakers to define a result framework for each program to ensure that they are being implemented effectively and they are reaching the defined goals and objectives for the specific program. Different type of indicators can be defined for that. That would actually help to understand what are the number of beneficiaries that we're reaching, what is the poverty impact, what are the changes that happens within the employment or within the livelihood. So this monitoring and evaluation part really helps to make this provision of the social assistance impact driven, which then makes it a very powerful tool. And of course, we have like grievance management, case management components, determining like graduation or exit decisions, etc. So this is like the core platform that we have been working on and expanding for the last few years. Synergy has a large expertise in delivering such solutions in different countries. So with our expertise, the solution also involved trying to cover the complete cycle of delivering of safety net programs. Yeah, thank you.
Thanks so much, Lilit. That's an excellent overview, and I will come back to you with some follow-up questions on some of those points here shortly. But for now, let's move into talking a little bit about the Barbados case. So Leah, my next question is for you. And how is Synergy designing a unified social protection system for the Ministry of People Empowerment and Elder Affairs in Barbados? And what other country social protection information system solutions have we used as lessons learned, as Barbados is newer to this process and going through this design of a unification strategy currently?
So as I mentioned, for the Ministry of People Empowerment and Elder Affairs, Synergy provides a solution with unified platform, which will be served with, which will serve the needs of different divisions and departments within the ministry. So different users on the different divisions of MPA will have a single login screen, will have a single platform for their daily operations. And of course, the system will be the same for all the divisions, but the users will see only limited scope of the system, which will be accessible for them, for their role, and that part will be managed by the administrator of the system. As I was mentioned during my speech, we have a centralized database of the household and the personal profile, which will be used by different divisions within the ministry. And of course, like starting from 2040, Synergy started developing social protection programs. The first case was in Timor-Leste. Then we had a project in Maldives. Then we started the project in Bahamas, Philippines, Sudan, Indonesia, Nigeria. And currently we are working on the projects of Trinidad and Tobago for the governments of Trinidad and Tobago and Zimbabwe. So we have wide experience of social protection projects, and with each project, of course, we have lessons learned, and we improve our system with each project and with each client and apply those lessons learned in different projects. And currently in the Barbados case, we got like the similar approaches. We have similar approaches applied in Trinidad and Tobago project, and like we got the lessons learned and applied on the Barbados case.
Great, thank you, Leah. So Lilit, I'm going to throw it back to you for another question here. And Jaimie, once Lilit has given her answer, it would be great to get your opinion on this as well. So we have a webinar here where we have both Synergy technology representation and ministry program implementation representation. So this is the team that works together to co-design and co-develop the system that ultimately gets used. So Lilit, let's start with this question for you. How can social protection ministries work to co-design this integrated beneficiary management systems and social protection systems with their technology partners, whoever they may be?
Okay, thank you, Tim, for that question. Part of our work, like as Synergy being the solution provider, is to conduct an extensive system requirement study with different ministries who plan to have that co-design of the unified social protection system. So it involves working with focus groups, interviewing, and a very important aspect to focus is the harmonization. Harmonization would mean that the system that would accommodate all different range of social protection programs, it will have some modules that are generic and they would support all of the programs. So such modules would include the administrative modules, the security, to keep the data secure, like role-based access, attribute-based access, business process management, notification, communication with beneficiaries, grievance messages, like grievance mechanism, M&E, etc. So those would be the modules to support all the programs. But the program's implementation itself needs to be harmonized and coordinated. And that would mean having like a standard data collection form that would be suitable for all programs, because this is the main, so the beneficiary data, the household and individual data is the main data that would be served for all programs. Then standardizing the operation and processes. So this is a very important exercise that the ministry will have to perform, and me myself, I will be happy to hear also Jaimie's thoughts on this, because we as a consultant, we offer our past experience, but we mostly speak from the technology point of view. The real challenge lies within the ministry to do this harmonization. Another aspect is to consider the interoperability within different existing systems for the government agencies. This can be either the National Registry of Individuals and Legal Entities. This can be payment service providers. In case of contributory cash transfers, this can be integrating with a system on those contributions or even contributors. To share the data within the different government agencies. And for us as a solution provider, again, we understand that the programs, they are very, very different. So they can range like from disaster and crisis response to health care, or education, etc., social welfare. So they are very different. And even new programs emerge. Like recently, we've witnessed a lot of new programs in different countries emerging due to the COVID-19 response need. And the existing programs itself change because the continuous improvement lies within the program to have the lessons learned and to improve the delivery of social assistance to vulnerable groups. So the solution and the system that we provide, it must have a certain level of dynamic, to be dynamic and flexible to accommodate such changes. So this is what we put a great emphasis on, so that the system, with this system, our clients are able to do certain customizations on the data set questions. Sorry, I'm technical. On the data set questions, or on the targeting criteria or the payment periodicity, etc. So this flexibility must be embedded in the system, and we're putting high emphasis on it. I would also be very interested to hear Jaimie's point of view on that as well.
Thank you. One of the things that we must establish first is to identify a standard operating procedure that helps you in identifying how we are designing that system. One of the things that was very interesting when we were designing our SBMIS, there was a work study. So Synergy came in, they would have visited our various areas to see what was the process. By using that process, they would have taken the visual aspect and turned it into a business design process, but step by step. Yes, there's the coding, of course, there is the technology, but being able to see how the process will work step by step helped us and helped them Additionally, we find that sometimes you must be flexible because we may have a certain procedure, but it may not be able to be done within a process because it will affect another component of the program. So at times you must be flexible to understand that you may have to rewrite a step in the process. I also like that you must identify your operation manuals, and those operation manuals helped the technology companies to identify how are we designing. For instance, with our targeting process, we had to ensure what were the requirements and how do we capture the information that was required. And even in the enrollment process, what would happen during the enrollment process? And more so as we moved on into our beneficiary portion of it or the payment modules of it, we discovered that at times you will encounter challenges, but you must look at what is that design process. Synergy has been very flexible. They're creating new pathways for us. And I must say it's a continual learning process for both the user as well as the design company.
Great, thank you both for your thoughts on that. Lilit, this is a similar question as to what we've just been talking about here, but from our standpoint and from any technology provider standpoint, what have you found are some of the most important attributes when we're working with a ministry partner to ensure a successful, long-term, sustainable MIS design and implementation?
Thank you, Tim. Earlier, Jaimie mentioned buy-in, and I would fully agree on that point. So having a champion that would lead the initiative, that is passionate about this change, and to be able to get the buy-in from different stakeholders, I would say this is the most important part in this whole process, both from a technology provider as well. Because we do need a supportive team that are able to conduct a good change management. So a good change management plan in place is very, very important. Even with internal process change, like moving from the paper-based to some harmonization, defining operation manuals, etc. So this is a huge change for the organization. But Leah also mentioned that we have this public portal where the citizens themselves would be able to apply for some of the assistance programs. So this is even a bigger change because citizens are involved, and normally there are issues with the connectivity with the internet. So we need to give access to laptops, to internet for the citizens to be able to apply for the programs, which means that maybe different kiosks or the social offices needs to be in place. There needs to be people to support the process. So this again goes to resources. I'm kind of reiterating what Jaimie was saying, but those are very, very important things, like the buy-in and the resources and a great change management plan. So from the technology point, it's the easiest part. the hardest part lies on the ministry actually to roll it out, to implement it, to have resources to sustain the project after the contract has ended, to have a team of administrators to work on the system and to move it forward. So these are key points that I would mention.
Thanks, Lilit. Just a reminder for everyone in the audience, we've got 15 minutes left here. So if you have any questions, please message them either to me directly or to the Synergy, the Synergy International Systems message box, and I'll do my best to get to some of those. But Jaimie, let's bring it back to you here for another question. We're talking about change management. We're talking about being flexible. So how do you and how does the ministry work to design to the social protection ministry continuous program improvement and improving the national social protection strategy and adjusting to external shocks like COVID-19?
Interesting question. We must continually analyze how is it working? What's happening with our system? Is it easy for the user to use? What do we need to change? What can make it easier for the external user? When we talk about the portal, what are some of the challenges that may happen? How do we analyze that? And once we look at that, we have to, would we modify what we may have thought may have been an easy solution, we have to look at it and re-identify and said, maybe this is not working. We have to make it more manageable for those persons who need to use the system. Additionally, we have to look at what's happening within our organization. How do we make simpler steps? We would have designed a system, of course, we thought it was a perfect system. And then COVID-19 came. And our system was based on persons coming into the office, being interactive with our social workers, and we discovered that didn't work. So how do we then define, what do we need to look at? What did we have to modify? And so you analyze and you regroup and you recreate. And sometimes it meant that the technology part of it had to be written, or we had to make adjustments to the current MIS to provide those solutions as well too. So it's an ongoing process. And like Lilit would have said, the system administrators will play an integral part because they are going to monitor what's happening with that system. What are some of the challenges? How do we continually improve the system to make it a user-friendly system, as well as to obtain the necessary information that we require on a day-to-day basis, or even for monitoring and evaluation. And by that, we get a lot of reports. So everyone's requiring a part of that monitoring and evaluation. What are the reports that you're requiring? So are we capturing that information? And so we look at those reports to define what is happening in that system. Thank you, Tim.
Great, thanks, Jaimie. I'm gonna keep it with you, Jaimie, for another question here. So, in the Bahamas, the ministry has been working on this for several years now and has made incredible operational strides. So now I feel like it may be time to start thinking at an even higher level of strategy. So my question is, how do you track, or how would you like to track, the return on investment for social protection programs? Social protection programs are investing in people to help raise them to a stage where they can improve the overall welfare of the country. So how is the ministry thinking about right now, how do we actually, from a statistical or data-driven level, measure, or how would we like to measure the return on these investments of these programs?
That's an interesting question, because currently we are in discussions with our Department of Statistics, and they are finding ways to ensure that we are capturing the right data. Additionally, we look at things that what's happening within our schools. So we're going to use that information to assess what is happening within the educational system. What are the students of those who are beneficiaries? Are they attending school? What is the enrollment rate? What are they requesting of us to empower those students? Additionally, what's happening in the communities. And so a part of the Ministry of Social Services and Urban Development is our urban development, and they are actually in the community. So they are our eyes and ears, and they allow for us to see what is happening within our communities, within our islands. What is the progress of our clients? Are there challenges? And they will bring those challenges back to us, as well as our social workers will tell us these are some of the things that may be happening. We also look at there have been new businesses starting, and what is the graduation rate amongst our clients? So internally within those reports, our social workers and our teams will analyze, and they will present reports as to what's happening to the various divisions of our department.
Excellent. Thank you so much. All right. So I'd now like to shift into some questions that we've received from the audience. So I'm not going to direct these questions, Lilit, Jaimie, Leah, at any one of you in particular. These you can just, one of you or multiple of you, feel free to weigh in as you see fit. So the first question from the audience is, how can skill development opportunities be integrated into social protection interventions? So maybe rephrased another way, what are some specific examples of skill acquisition or development, social protection specific programs, and what does the design of those look like?
Within the Bahamas, we partner with our national training agency. So we refer persons, we encourage them to enroll in the National Training Agency to develop various skills. Within our National Training Agency, they then refer them and place them onto job sets. We're also partnering with the Bahamas Technical and Vocational Institute, where persons obtain certification by attending classes and receiving degrees and certification in various areas. And there is a government grants program, educational program that funds this and assists those persons to attain those skills.
Excellent. Thank you, Jaimie.
If I may also jump in on that.
Yeah.
And actually, it may be a follow-up question from me to Jaimie. So I understand that skill development is very important because it would allow to build capacity within the household, right? So that after people actually receive the assistance, they are trained, or they do the on-the-job training, they can actually participate in employment. My question is, when integrating these skill development into social assistance, do you normally tie it with like conditional provision of other assistance? Like, for example, so people they need to participate to such trainings or skill development on a condition. No, basically they will receive some assistance, whether it's food or other or cash, on a condition that they also participate to such training or skill development activities. Is it something that happens in Bahamas or no? Why I'm asking, because there was a recent study, I think, for countries in Latin America, and this is the main strategy that they use. So I'm trying to understand whether it's the same or different at your side. Thank you.
We currently have no conditions. We understand there have been discussions to review that. What happens is part of the case management. Our workers refer those persons, and it is their job as the case management to review and monitor, is that person actually attending these? How can we continue to encourage them to attend it? What is happening within that household? And so creating that relationship with our clients, which is a very important thing. They refer them, they give them the necessary resources to attend and assist them in sort of guiding them into the next step of building their skills capacity.
Thank you.
Great. Okay, so I'm gonna combine a couple questions into one here for our group of experts here. So we're getting some questions about payment and benefit delivery and how does that work. So the two sort of questions are, how are benefits actually delivered to beneficiaries of these different programs, and what were some of the challenges in implementing different payment systems, and how does it work with banks and merchants and citizens and integrating all of these different things together?
I'll go first, Lilit.
Okay.
So what we're using are two forms of payment currently. We are using our prepaid cards. So the beneficiary receives a prepaid card. They're able to go into the grocery store or a food store to purchase the necessary food items that they require. And then we use a digital wallet. That digital wallet is used for our rental assistance program, and it's also used for our food at this time. So there's the option with the food assistance that a beneficiary may use a prepaid card, and then there will be the digital wallet that they're able to access. And so that is integrated into our system at present. What were some of the challenges? With every new system, especially with banking, we know that cards expire. And so one of the challenges is, even though those cards expire, the bank worked with us to ensure that we had an ongoing process. But getting persons to accept that this is now a new form of payments, whether it was the prepaid card or it was the digital system, it presented challenges because it was new technology. We would have moved from a paper-based system where they just took a slip of paper, but getting them to understand that the prepaid card, you can use it, and it's a Visa prepaid card, and they can use it anywhere that was being accepted by Visa for local merchants. And with the digital wallet, to say to your beneficiaries, you're now accessing it by your phone, and your digital wallet will be able to provide the same assistance to you.
Great. Lilit or Leah, do you want to jump in maybe from the technology provider side on payment systems?
Sure. Just to add on top of that, that from the technology perspective and from it's more preferable if the country, if there is an integrator payment authority available that would actually will have the means and the ability to integrate with different service providers. And then the social protection system would integrate with that one authority. So this will help with the inclusion of vulnerables into different programs. Because otherwise, if we're just looking at a certain payment service providers who have these wallet capabilities, and then we need to ensure that people actually use that service provider, they have the wallet or the mobile phone, and they can receive the services. So if we are just integrating with specific payment service providers, we're kind of excluding a certain number of people from receiving the assistance electronically with this integrated way. However, when there are countries that have this authority that is actually responsible for distributing the payments across all the payment service providers within the country, that makes this inclusion possible of different vulnerable groups.
Great, thanks, Lilit. Okay, last question, and then we'll wrap up here. So this question from the audience is, what are some policies that have worked, that have helped strengthen the social protection of vulnerable women? So for Lilit, Leah, that could be from any of our global portfolio of social protection projects, or Jaimie, if you want to speak to that specific to Bahamas.
Yeah, in terms of policies themselves, maybe Jaimie would be better positioned to answer, since we're more on a technology side on this. But maybe this is not a program that is being actively used. So maybe it's not the exact case.
Currently, it's not being actively used, but it is being addressed by a Department of Gender and Family Services. They are operating with various policies and programs to ensure that women receive, and they liaise within the Ministry of Social Services to ensure that women and females are being receive the assistance that they require or need at times, but it's not being captured in its entirety at this time.
Mm-hmm. Okay, got it. And I can just speak from some experience as well to the audience member of, oftentimes there are sub-programs that are created that are perhaps targeted at female entrepreneurs, and it really just depends on different ministries of gender and how they collaborate with ministries of social protection to create specific sub-programs. So that's how I would answer that as well.
I would also tie it with the food security and actually women owning land, because this also relates to the topic of the question.
Excellent. Okay, Lilit, Jaimie, Leah, thank you all so much for being wonderful experts on this panel. Thank you so much to our audience and those who sent in questions, those who didn't, those who attended. We so appreciate you all being here and helping us create this forum. This will not be the last one of these. We will be back soon with another social protection themed conversation. Please feel free, you all in the invitation have my email. Please feel free to reach out to me at any time with questions or thoughts about this program or other social protection ongoing efforts at Synergy. So thank you all so much, and we can now close the webinar.
Thank you.
Take care, everyone.